welcome to Skin Side Out. So, for this episode, we will be talking about everything facial. So, what will they expect in this episode, Doc?
Yeah, we're excited to share with you what facials really are. It's something that we keep hearing, diba? You'd say it na, I'm gonna have a facial, but we haven't really taken a deep dive as to what it really means. So we want to talk about that, why it came about, diba? Why people are so eager to have facials and what it can do for you.
Yeah. So, stay tuned, relax, and enjoy this podcast. Hi, Doc. How are you?
Hi, I'm doing good. How about you?
I'm really doing well. Well, apparently our live stream talaga did so well, especially the numbers. So we are back for more.
Yeah, we're excited to share things like new information with everyone because that's really something that we are passionate about. We want to help others like know more about skincare. You want to help others be more familiar with how to manage their own skin.
Yes, and taking care of our skin and hair health as well.
Mhm.
So, Doc, let's get right into the nitty gritty now. How often do you prefer to get your facial done? Like, ikaw po, personally.
Well, as mentioned, you have to remember that I mentioned before na our skin, 'di ba, facials or our skin changes normally every 2 weeks.
Every two.
So ideally, you can have it every other week. Like professionally, you can have it professionally done, but it also depends on where you get it. Kasi there are some facials na it's not just facial. Pag sinabi mo kasing facial, it should just be really cleansing, just deep care for your skin, di ba? But there are some facials na it's more advanced. Like some do advanced diamond peel or they add procedures already to your regular facial. So sometimes if you do it too often, same with the state of you rubbing your face more than 'di ba? I don't really recommend using scrubs
Oh, yeah.
every day. So parang ganun din siya. So normally facials can be done once a week or every 2 weeks.
Every 2 weeks.
Mhm.
So that's like the normal go to that a normal person should do.
Yeah.
So when it comes to facial, Doc, so like my personal favorite is the total rejuvenating
Mhm.
facial because I feel like I have like dull skin. I don't really have pimples like often. So sometimes it just feels like, yung parang walang life and all. So how about you? What's your go-to?
Yeah, I like the collagen and the crystal facial.
Crystal
Kasi naman,
facial.
for me naman, my skin's a little, more on, kasi if you look at it, you have smaller pores or very small, 'di ba? Hindi. There are some, like ako, I have, not naman my whole face, but some areas that are relatively, medyo open. So, pag ganon,
Open
I like the
pores.
crystal facial kasi it has mild exfoliation.
So, pag
So,
open yung pores, it's important to have, like, to exfoliate.
parang mas malaki, like for example, if this is your pore, because pimples come in to the pore.
Oh,
So,
yeah.
'di ba? So, if it's bigger,
Mm-hmm.
mas malaki yung area, 'di ba? Na pwedeng magbara. If it's smaller, mas less na pwedeng magbara. Para there's little space for it to clog. Kaya rin hindi ka masyadong pinipimple. But for those who have bigger pores, you can check yourselves in the mirror. You can see, minsan dun din sa areas na yon, dun ka rin mas ay, parang dito ako mas nagkaka-pimples because of the pore size.
So, that's the crystal facial, right?
Mhm.
Ooh. So, Doc, what really, like, happens when you go through facial? Like, what's the procedure? Can you walk us along that?
Yeah, I can walk you along with the facials that we do at Dermclinic because I think in other areas there are different standards to facials. Some would just have it na the cleansing, yun na yun. Some would have it na cleansing, massage, rejuve, that's all part of the facial. Others naman, um, they do also pricking. For us kasi, we do it separately. Meaning, the whole facial setup, it's really you cleaning out, like deep cleaning your skin. It's like doing general cleaning kung sa bahay. So that's what we do in facials. That's how Dermclinic does it. But for some kasi, sometimes that's why it's kind of thorough. So, ibig sabihin, from the cleansing, we do different kinds of cleansing. We ask you to cleanse your face. Then, our nurses, our facialists would be the one to help you. They do vacuum. So, there are
Oh.
steps. And then, there's laser toning. Toning somehow just improves the um, ion concentration or the evenness of the skin. So, parang there are simple techniques that are being done, but basically the overall goal of facials is really to kind of deep clean
Deep clean.
your skin.
So, dog, like if you say facials are really for deep cleaning, so why do I have to go to, like, let's say Dermclinic? Why do I have to go to a dermatologist to get it clean? Like, can I not do it at home? Like, bawal ba yung DIY?
The DIY kasi sometimes there are steps and there are limitations. Like usually when we do things in the clinic, we meron techniques that are supposed to be done. When you do it at home kasi, the problem is sometimes you get too comfortable. Ay, parang ang sarap mag 'di ba, mag-exfoliate, ang sarap magganyan without you knowing that you're over exfoliating. So
What's the dangers of overexposure?
I have a patient one time na parang her skin was okay. Like, she's like you. She has small pores, so wala naman talagang concerns. And then one time, she had like breakouts. So she was concerned na it was out of the blue. So like, I asked about, what are you doing? What do you put? So wala namang nag-change talaga in habits. So I tried to give her a specific advice. And then later on, she started to open up. Na, Doc, I have pala like the DIY massages that you try to do. And then I told her, that's why your skin is more dry. Kasi if you do it too often, sometimes you feel like it's comforting for you, 'di ba? But there are habits na if you overdo it, you also remove the natural moisture, the natural oil of your skin. So what's good with facials is the techniques are well curated, meaning like we wash na ganto katagal, then after we replenish it with this with creams, then we allow you to just remove the dead skin, then we do laser toning, then we do there are machines or equipments that are used, like for example, meron, I think some of you who have tried facials, yung bina-vacuum,
Yeah, the back.
'di ba? So yung mga ganon na usually it's best done by someone else, and it's really best done by someone who's trained. Kasi oo, kasi that's why I mentioned na iba yung facials. That's what facials should do. But some actually add acne surgery to facials, which is for us, that's a no-no.
What do you mean, doc? Like acne surgeries?
Acne
Like,
treatments.
mm,
Like for
like a
example, ang facials po, it's really recommended for those like with clear skin, wala ka talagang concerns. But if for example, you have skin condition na medyo, ay parang I think I have breakouts.
okay, yeah.
It's best to really consult with a doctor because breakouts usually is a sign of infection. So, may sign na it's a skin infection. So, pag diniretso mo lang yan ng facial, tapos biglang hindi maayos, hindi sterile yung environment. And then, sometimes, the person who does it might not know, or alam mo yan, nagmarunong lang na, ako tatanggalin ko na yan, di ba? Without really having the tools, without really having the expertise, it can get worse. So, and usually, kapag ganon, we have a separate recommendation. We don't recommend for a patient. Like, if you come in the clinic and then you have a lot of pimples, we won't really recommend the facial
Okay,
because it
okay.
won't help.
Yeah.
What we will recommend is an acne treatment with a consultation with a doctor na kasama naman na yon. Usually, kasi mas thorough yon. There are some na ang ginagawa, doc, isa lang naman, inject na lang, tas wala.
No, yeah, yeah.
So, sometimes it works, but there are sometimes na hindi rin. So, it's best na tingnan because your acne doesn't actually appears na hindi siya, like, ba kunyari, may acne ka dito. Pag iniisip mo, after a week, mawala na yan. Tapos magugulat ka, meron na namang tumutubo dito.
Yeah, on the other side.
Yeah, so it's very hard. So, it's best na the doctor sees, doctor cleanses your skin.
Yeah.
The doctor treatment kasi that we have, meron siyang peels, which are only allowed to be done by doctors
So
at their clinic.
peels are like facial is the one that you cleanse with your face. So peels is like the added service.
Yes, it's an added service. But
Mm,
it's included in our acne package because madalas talaga the problems of acne, there are actually four major causes. Number one is oil.
oil,
So
yeah.
pag oil ka, mas nagdidikit-dikit and then
Mhm.
your dead skin stays on the surface of the skin. So mas nagla-lock in, tapos may bacteria, 'di ba? So tas may dirt. So lahat 'yon, those factors are building up. So what
Mhm.
we do with peels, but remember there are levels of peels kasi if you overdo it, like kunyari may makita ka, teka, I can
Chemical
just
peel.
do my own peel at home.
Yeah.
Na possible din na masunog if someone's not skilled. There's a
Mhm.
proper way to really handle it. Like there are things personally that I think can be learned online, but there are things that you cannot learn
Yeah.
online. So, 'di ba, may mga bagay like even in your house, there are things that when you watch a movie or a video, I mean, that you can see, it's easy pala, I can do this. But there are techniques that are more for professionals. I realize kahit itry ko siya i-assemble, it's not gonna work. So, in derma, there's also things like that.
Yeah.
Mm.
I remember growing up, uso na yun yung YouTube videos, right? We had like very big vloggers when we were 12 years old. Then they would have all these DIY masks like yung what's that? The antibiotic. They would crush it, or
Yeah.
the vitamin C, they would crush it and then put petroleum jelly. So obviously I think I had my own fair share of those experiences, which later led to so much breakouts,
Yeah.
so much unwanted skin problems. So, is there also a facial for like there's facials, right? So there's also hair shells.
Yes.
So what's the difference between facial and hair shells?
So, facials, yun yung mas alam natin because it's like maintaining, prepping, or cleansing your skin. Or at least, kasi the skin, you mentioned that it was dull. Pag
Yes.
dull, ibig sabihin, the dead skin is still there. Parang what you
Mm,
want to do is at least supplement it with facials para matanggal din yung excess dead skin and then new skin comes out.
okay.
So for hair shells naman, it's similar to what's done with facials, but it's really addressing the concerns of the scalp. Ang need mo kasi for your scalp is really um removing the oil, removing the dirt, 'di ba?
Yeah.
And sometimes if um there are conditions like psoriasis, seborrheic
Mm,
dermatitis na affected yung scalp mo.
yeah.
Meron din namang concerns that like alopecia sometimes that doing hair shells, it helps bring back circulation. So yun yung
Ooh,
maganda if you go to a clinic, you have a hair shawl, it prepares or improves the passageway of the skin.
new
'Di ba?
yeah,
Parang
yeah.
it allows your hair to flow smoothly, it allows your hair strands, alam mo yun,
True.
to grow better. So it parang takes care of your hair in a
So if
sense.
facial, like you can get it every 2 weeks, ganyan. For hair shell naman, how often can we get this?
For hair shells, you can do it especially if you have a hair concern. Kasi sometimes for those who have feeling mo your hair is thinning,
Mm-hmm.
better na within the first month you have it once a week, or if the schedule does not permit naman, twice a week. Twice a month.
Twice a
So, almost similar.
month.
Kasi very similar din naman na it's still on the skin.
Yeah.
It's just different na may buhok. So, but it's more thorough because normally with hair, wala namang pricking yan. Diba? We don't do pricking. So, normally with hair, we apply serums that are used so that when it's absorbed by the scalp, it helps improve the absorption of nutrients. It helps improve the circulation. So, mas maganda din yung nasusupplement yung hair growth.
Yeah. A while ago, sorry, Doc, going back to the DIY. So, for DIY, you cannot really, like, syempre, you cannot control. Minsan you get giggle, right? So, you get all of the blackheads out. That's one of the many problems. Filipinos, mostly, no? We're so high in blackheads. Ang high in blackheads. So, what's like the first thing to do to get rid of this if, for example, we cannot go DIY naman na facial because it's, it's what you said, it's dangerous. How can we get rid of this besides going to facials?
I think one way is to manage your habits. Like for example, staying up late,
Oh,
it increases your activity for your oil glands. So pag mas gising ka, your oil glands are more active. So it
double
increases
time.
oil. Yeah, so nagdo-work double time din yung oil in your skin. And if you have good skincare techniques like what I mentioned, so you just do a proper cleansing, um apply you don't it's not a must, but if for example your skin's a little on the oily side,
Yeah.
you can use toners, facial toners, but don't rub it, 'di ba? Tas use apply moisturizer and the sunscreen afterwards.
Okay, that's good. What's the difference between doc about like whiteheads and blackheads? Is
Okay.
there how do you differentiate it?
Well, blackheads, it's what you see na nakikita mo kasi siya na nagpe-penetrating dirt. The whiteheads, naka-closed siya.
Oh,
So it's
okay.
just with the appearance. Actually, when you look at it, the whiteheads, blackheads, and pimples, na we call it, these are all considered as stages of parang acne. Sometimes
Oh,
it starts na ganito. Kung baga, kaya better na pag feeling mo marami ka ng blackheads, 'di ba? Agapan mo na siya. You consult, you
mm,
look for um good skincare
yeah,
that and skin products that you can use para it will prevent it.
yeah. Since we're in the topic of facial, I wanna after this I wanna get my facial na. But like I noticed, doc, that sometimes we use the same products that works naman,
Mhm.
but then eventually it doesn't work anymore.
Yeah.
And then yun yeah, I would go to a facial and then it works again. So what's the logic behind that, doc?
I think it resets your skin. 'Di ba? Kasi there are some times na parang if you keep doing this, there's still a reset that your skin does. 'Di ba? For example, um because facials are really, as I mentioned, deep cleaning. So, normally, like in your house, you can clean your house na ikaw lang. But,
Mhm.
'di ba, normally, you also schedule na every now and then, you have like a professional clean it. Kasi although feeling mo okay naman siya, but when you after a professional visits, you'd realize, this is what clean looks like pala. 'Di ba? So it's the same then with our skincare. Sometimes when you're used to it, you feel like, ay, parang it's the same. But you don't know pala that it needs at least a deeper cleanse, a deeper intervention, which normally is being done during facials. But as I mentioned, I keep reminding kasi we're all used to hearing facials. Wag din po natin i-allow yung, just anyone to prick us, 'di ba? Just don't
Oh,
allow anyone to, "Ay, tatanggalin ko na 'yan." Kasi if hindi marunong or there are some nga na hindi lang, extractions, sometimes they do, "Ay, i-aano ko na 'yan, iko-cauterize ko na 'yan."
oh, yeah.
Because if it's not trained and ma-infect 'yan or, magkaroon ng scar, 'di ba? Ang hirap.
Yeah.
That's your skin. That's something that you need to take care of. That's one of the things na we don't realize. And sometimes we were talking about uh the DIY,
Yeah,
'di
the
ba?
DIY.
Pag nagdi-DIY ka kasi, what happens is or when you start pricking, your hands are not clean.
Ooh,
Yeah, your hands are not clean.
unclean hands. Yeah, tama.
So, ang nangyayari, when you do it and your hands are not clean, it's like it can add more bacteria. So, sometimes, I'm not sure if you've experienced it, but maybe some of you have experienced na dati maliit lang yung pimple mo.
Tas naman.
Because you pricked it on your own, you didn't go to a derma, parang, shucks, parang mas lumaki siya.
Yeah,
Yeah,
yeah.
because you weren't able to remove the actual problem. Parang naggalaw mo lang siya ng konti, but it's still there.
So yung myth na pag ginalaw mo yung pimple mo, magmumultiply sila. Like, what's that? Kasi yung the Tagalog term na magkakakambal yan or what, manganganak yung
Yeah.
pimple. It's because of the unclean
Yes.
hands.
And it's because of the infection, 'di ba? And
Mm.
anywhere naman, pag ayaw mong kumalat yan. So, 'di ba, dapat wag mo na lang siyang gawin. Let a professional do it para it won't affect the other skin that's not infected.
Ooh. So, Doc, at what age do you think, like, for example, I bet we have teeny boppers who are actually listening to us. What age do you recommend that they start going to, like, getting their facial done?
Normally, teens.
Teen.
And the main reason is when you start adolescence. because the hormones actually affects your growth, 'di ba? So ang nangyayari minsan dun din, parang mas oily yung skin ko ngayon, mas
Mm.
nag-iiba yon because of the hormones that are affected when we grow up.
So mga teens, mga like
Mm.
13,
Yeah, so it really
14.
depends. There's no fixed kasi there are some na
Yeah.
very young but mabilis nagkaka-pimples. So it could be because of their family history. So yun, that's why sometimes it takes earlier. Meron namang iba that they finish high school tas pagdating ng college okay pa.
Okay pa.
Or tas mamaya pag-graduate na, alam mo yun doon,
Yeah,
merong late. So it depends really on your skin condition, on how if you see changes na parang you think you need advice, you think that
Okay.
it's not as as easy to manage as it was used to, then I'd recommend you just consult with a doctor.
Yeah. So it does not necessarily mean na I hear that from moms, ay wag ka pa magpa-facial kasi baka lumala. So that's not the truth.
That only happens kapag nga the facial that's why I mentioned na magkaiba po kasi yun. Like if it's a facial that's done and I mean for us if you do full facials, there's no pricking.
No
Like
pricking.
that's assured kasi nga that's a different. Dapat a doctor sees you, dapat it's consulted. But there are some syempre like they feel like ay kaya ko na po yan, tanggalin ko na yan, 'di ba? It's so sometimes I think the trauma of some moms or parents or even kids come from getting treated wrongly. Diba?
That's like really the main issue also. That's why people are so scared to get their facials
And
done.
the sad thing is, pag ganon, like, they'll start telling them, ay nako, wag kang diba?
Yeah,
It's a
yeah,
general perspective na wag kang magpa-facial. Kaya, it has to be contextualized in terms of, saan ka ba nagpa-facial?
tama.
Diba? Sino ba yung nag-handle sa'yo?
Yeah,
Because it's hard.
it's
Like,
hard.
especially now that everyone's into facials, everyone wants to like get in, 'di ba? Everyone wants na
Glow
teka
up.
kaya ko yata gawin 'yan ah.
Mm.
But remember not everyone has trained well for that. I've heard of stories like with friends who live in the provinces na minsan maraming nagtatayungang um facials like
Aesthetic
like and you go
centers.
there
Yeah,
because it's something that can beautify you. But if
it's
they don't know how to handle it, it's gonna be hard for you. I also heard there was one time na kasama sa cleaning ng face, applying alcohol. So that's too harsh. Yeah, so diba, it's done
gosh.
kapag hindi proper yung care. So it's important that
You should
you don't just go to somewhere okay dito kasi like 'di ba may promo or ganyan because if you don't know the quality it might also affect you even when you do facials kasi if they don't keep a sterile environment, sterile meaning very clean like yung pang hospital na um naka-prepare lahat, like hindi pwedeng hawakan yung things just to make sure na walang bacteria. Pag pangit yung setup or they don't really clean it, that can also be a source. Kaya 'di ba may iba na nagpa-facial tapos ba't parang kung kailan ako nagpa-facial saka
parang dun lumala.
Oo.
Yeah, yeah, yeah.
Kasi it
I
wasn't
hear that.
handled properly.
So talking about these aesthetic centers, we don't really mean to throw shade at them, but what is the right price? Because there, it's they think it's mura, 'di ba?
Mhm.
Sometimes na yan okay yan, or sometimes they think that it's too mahal, so it's good.
Yeah.
Like there's two mentalities of
Mhm.
So what's the right price, doc, when it comes to getting your facials done?
I think you have to ask, ano yung kasama?
So what
'Di
comes
ba?
with the facial?
What comes with it? Is it just washing the face, ito, 'di ba? Kasi some, like I think for us, we have like a 10-step for facials. So it's a series na being done. Like there's a routine that's followed. So we won't skip that step. So ibig sabihin, you're assured na you get that. There are some na sabi, hindi, mas mura sa amin, but you get just 2 steps. Or 3 steps, 'di ba? Like you get the wash and then mask, tapos okay ka na. Like steam na.
Finish na,
Oo.
yeah, yeah.
So you have to it's hard actually to gauge kasi different offers sometimes have different components.
That's
So, but
true.
you have to really check. You can ask. I think what's good now is we have information everywhere. So you can ask, You can, if you have friends also who can find recommendations that they trust, better na ganon. Kasi at least you're assured din of the quality. Kasi remember, it's your skin.
It's your
And
skin.
the problem with that is if you get an infection, if your skin is okay, di ba? And then you went to somewhere else tapos it wasn't managed properly. Tapos pagbalik, 'di ba, you get a pimple, you get a scar na parang that's irreversible.
Yeah.
It's very very hard to do. So
Yeah.
nakatipid ka nga when you first went, but the after effects are worse. So it's best to really just check which is like a good clinic or a good area wherein I can get what's needed.
Yeah.
And I think I really recommend that um you look for a place that has a doctor.
Doctor.
Yeah, that can consult your skin. Kasi like normally even for us, like we do a lot of treatments. Our nurses also do several treatments. But for example, there is a basic assessment.
Yeah.
Tapos for example, pag nakita ko kunyari ng nurse or ng doc, parang I think namula. What do we do? So
Yeah.
automatic,
May,
doctor, yes.
may lifeguard.
Yeah, parang ganon.
Yeah, there's a lifeguard. And I remember what you said during our live stream that the thing about skin, you don't know if because every skin condition looks the same, right? So I think that's why it's important to have a doctor, is because they know better. You guys
Yeah.
know better. So with you knowing what the condition of the skin is, you know how to treat it.
Yes.
Yes. So, Doc, when you go to like a facial center, clinic, what are the things that you need to look for me to trust the clinic for a facial?
I think you have to the best thing is really to ask.
Okay.
Diba? Ask first what's they're offering, what's included so that you're aware.
Okay.
Diba? So that it's not na kasi sometimes yun nga iba-ibang clinic they have different offerings. So sometimes what you know was facial may be different for them. What you know was laser may be different for them, especially now that there's a lot of words that you keep hearing with clinics, diba? Lasers, microneedling. So, ang daming terms that at least you need to be aware of or you need to ask. So that you're aware kung paano nila gagawin, what's the technique. So, I think that's first. And second, you have to also check if they have who's gonna manage or who's gonna treat you.
Okay.
'Di ba? Kasi I think if it's there are treatments like facials can really be done by professionals. Facials can be done by those who have been trained. But
Okay.
there are procedures that are really required na ito dapat nurse's procedure to, dapat ito doctor's procedure to.
Only.
So there are particular like anything using like acne surgery or sometimes the lasers that would have an effect on the outcome, 'di ba? Yung mas better na someone who really has been doing this for a long time. So, it's best na there's really no clear-cut way. Alam mo yun? But I hope that we don't just go after this one's mura, this one's easy.
Okay.
'Di ba? Parang or ito malapit kasi dito. Let's also check online. Let's learn about it. Learn about facials. Let's educate ourselves. What does a hair shall do? What does because now naman everything is online. So you can start learning a little more about what treatments should be for me. Then at least when you go there, you have like a basic knowledge.
Alright.
Doesn't mean like you have to know everything, 'di ba? If there are things that you can ask, it's best that you go to a clinic where there's a doctor talaga. If it's really a skin concern, kasi if you just go to a place na facial, sige, okay lang yun. Pero if you want na parang, you want to be able to consult with someone na kayang mag-explain, and or if you have a specific concern na, Doc, parang medyo, ano yata, parang my hair is thinning, or I think like my face is adjusting differently to my new set of meds. Pag ganon, it's best to really look for a clinic with derma so that they can tell you how to do it, what to do it. Don't just go na facial ka na lang agad, mawala din yan, di ba?
Yeah,
Because
yeah.
you're not sure if the facial that you're gonna do can be applied for your
Yeah.
condition.
So it's not really just following the trends now. Oh,
Mm-mm.
this is a trendy facial place, so I'm gonna go here. But actually, to really go
Mm.
and thoroughly, because you're gonna spoil yourself na. Spoil it not to the max. Like no, but if ever you won't end up with lifelong issues with your skin
Yeah,
later
I think
on.
the best way is um you have to know first. Are you going for a facial because you just want to be pampered and your skin is okay? Or at least wala namang major breakouts? So if that's it, then you can go, 'di ba? Like mas less yung concerns mo. But if for
Yes.
example, you know that your skin is a little more sensitive,
Yeah.
you know that parang you have a breakout or parang you know that it's a little irritated, you feel like it's a little irritated or there are concerns that you have, it's best to consult rather than just trying what's the available facial. Kasi it's best also to know
Yeah.
if your skin is ready
Yeah.
for it.
That's
Mm-mm.
true. So, Doc, I will ask a series of Dermclinic's facials and then let me know what your thoughts are about this. Okay? So, for example, when it comes to a beginner facial, like, oh, it's my first time.
Mhm.
What do you recommend?
I recommend a total rejuvenating facial. Kasi you mentioned earlier, diba, that sometimes you feel like your skin is dull, na parang it's lifeless. So, it's good kasi it really just gives your skin a boost.
Okay.
So that's what the total rejuvenating facial is for.
Okay. And then you also mentioned the collagen
Yeah.
facial. That one naman po is
The
for
collagen is can also be an alternative if you feel like you want na mas plump
plump.
yung
Yeah.
skin mo. So it's more of like you feel like it's really in a different sense na parang it's all parang going down. Alam mo yun? So you want
You
to
need a lift.
somehow, yeah, lift it a little. But remember, facials are not permanent.
Facials are not
Yeah, for
permanent.
facials are not permanent because as I mentioned, it will just cleanse your skin. The first action is really just cleansing, deep cleansing your skin, giving your skin like a boost, giving your skin a massage. So that's what it really does. But
Yeah.
it can't give you like really, really permanent result na parang after one facial, I should look different. So, di kaya ng facial yun.
Magic. But also regarding that, you said massage. Right now, it's all over TikTok about like the buccal fat massage where they put your ano pa inside out ganyan. I know we have something similar to that. Is that the contouring facial?
Well, it's not really addressing that, but the contouring facial, it somehow addresses kasi when we stand up, our our face, 'di ba? Our skin is pulled by gravity. So naturally, it parang feeling mo as the day goes, 'di ba? You feel like your skin also goes down. So what happens with contouring is we kind of realign and reposition and it deals with you. I think you've heard about it or you're familiar with the lymphatic drainage.
Lymphatic
Yeah,
drainage.
so it's where parang it's in our body, 'di ba?
Yeah.
So it somehow we reposition it with the scales,
Mm.
with the massage, so that it's anchored properly. So what the contouring facial does is it gives you that it helps you achieve kind of a less puffy face. 'Di ba? And then so the collagen naman, if feeling mo parang you needed something na you look. But sometimes naman you feel like you're too puffy.
Yeah,
'Di ba? So you want something na parang will give you like a slimmer appearance.
yes. But I want to go there and get my contouring facial.
Yeah,
ASAP.
actually this one can be done na if you have an event.
Ooh,
Tapos you want to somehow
look snatch.
yeah, that's good. Like if you can see you can actually see the results before and after. And remember this one you're not gonna do like it's not like you have to pay a lot.
Yeah.
It's really just a facial, but the techniques, that's what we that's our signature in Derm Clinic. The nurses, the that we have, they really have been taught like good techniques. So it's really the technique that sets all the difference.
Wow.
So if you haven't really tried a Derm Clinic facial, you have to try it so that you can really understand what the difference is.
Yeah. Okay. That's exciting, actually. Thanks, Doc. So, next up, so this is for the people naman who you guys already know what to get. But then, what if you want to try something new? So, dyan papasok si Black Peel and
Yeah.
Immuno C. So, what is this, Doc?
Well, actually, black peel is a little more advanced in terms of if your skin is more on the oily side, you have an option of getting the black peel or the crystal facial. Kasi it somehow does the extra effort. The black peel, the name itself, it's not well, black talaga yon, but
Oh,
it's
black
not
talaga.
gonna peel your skin. It's
Mhm.
just gonna help remove the whiteheads, blackheads. So it's going to like add the additional support you need if you feel like you're someone na parang sobrang oily,
Oily.
like you feel like you need a reset, then you can get the black peel. The crystal facial naman, the action that it takes, we use a diamond peel to do it.
Ooh. So crystal
So
facial is like equivalent to diamond peel.
yes,
Oh,
we use a device so that it provides the same effect as a black peel. So pag if you compare it, it's just the different technique. So
technique.
if you like
Okay.
to use like I want a like uh slow diamond peel feel. So you can go for the crystal facial. If you want something
Mm.
naman ng mas gusto mo lang nakapikit ka then afterwards like you just feel clean. And sometimes actually I think some of the men have a preference for the black peel. So kasi nga it's I think women we like to be caressed, we like to feel that, but I think for men I just want it clean. So I think they sometimes prefer the black peel.
Oh, okay. Gets. So for the immuno C, doc.
For the immuno-C facial, there are three facials that you can use. If, for example, you've been used to facial, you want like specific concerns to address, you have three options.
Okay, three.
The first is the immuno-C facial. Of course, if you have like um you go to work. I know some of us are already staying at home, not going to work. But
Mhm.
if, for example, you're really exposed, you're exposed to pollution, you're exposed to stress, diba? The
Commuting.
immuno-C facial somehow gives you that vitamin boost for your skin.
Oh.
So at least it helps protect your skin to, alam mo yun, parang it
Mm.
revitalizes your skin. So that's
That's
what
nice.
immuno-C facial is for. And then we also have the intense whitening. So ito naman, if you want to somehow have that glow, like you have
Oh.
an event, you want to like, or sometimes also if you've been to the beach, diba? Mas gusto mong, teka, parang I've been to the beach the past couple of months, Christmas party na. You want to look fresh. You want to look like a little lighter. Not naman, actually
White.
not really lighter, but it's really the glow. You want that glow to show.
Yeah.
Diba? So you can have that intense whitening facial.
Okay. And last but not the least, we have the anti-aging.
Yeah, of course, the anti-aging. It's concentrated of where we do not want to see lines.
Oh.
Diba? So,
So.
syempre, it won't really automatically remove your fine lines, but
Mm-hmm.
it will help um apply the right massage and it's more hydrating. Kasi
Yeah.
sometimes, actually, lack of moisture causes us to look older.
Lack of
Yeah.
moisture
When
causes
you,
us
like,
to look old.
your skin is dry, you can actually look older.
Yeah, yeah,
Mm.
that's true.
And I think that's why people are saying, oh, that's glass skin. Kasi nga, you want na, it looks bright, it looks hydrated.
Very plump,
Mm-mm.
no lines. Talking about glass skin, doc, is it is it a myth or is it something that everyone can achieve?
Mm-hmm.
Like, how do we
Well,
get
I
glass
think
skin?
glass skin, I think it started with a Korean,
Yeah, the Korean trend.
yeah, with the Korean trend. But if you look kasi, I think one factor of that, you'd really look, most Koreans have that skin type. So,
Oh,
'di ba? Parang so I think that's the number one factor. It's also the race. So sometimes, 'di ba? That's the number one.
yeah.
Eh, minsan pag nakita mo, bakit gano'n? Like it doesn't look like
Dok, bakit ang dami ko nung trinhay? Ang dami ko
Oo.
nung trinay na products, ng facial. My skin is still not
Yeah.
glass
And
skin.
sometimes it's also the temperature that we're in.
So it's our country
Yeah,
too.
'di ba kasi sometimes if you've traveled, you've experienced that, dito na lang ako sa country na 'to. Like my skin's better here. I should like just stay here. It's
Yeah.
because my skin adapts better. And I think may factor din kasi the environment, the climate. So kaya
Mm.
um I think it can like Filipinos, we can work on it. We can try to get that. But siguro it's hard lang to claim. Oh, you do this and then you get the glass skin.
Yeah, it's not
Parang
like a one
oo.
one size fits all kind of thing.
There are factors that need to be considered, but I think one thing that can really help you achieve glass skin, number one is um there's a sense na yung pores are also smaller.
Pores.
So minsan, if
Maybe.
you really have big pores, sometimes there are other treatments that can supplement. Hirap siya ng facial lang you'll achieve that. So, but another is moisturizing your skin. So, and the third is, I think, having gentle exfoliation. Kasi somehow your skin is changed. So, palaging mukhang like it's bright. Palaging
Yeah.
it looks like it just came out of, ano ba yun? Yeah.
Mother's womb.
Yeah, it's very, very clear. So, it's like baby skin.
Yeah. Oh, so it's actually achievable if you constantly really work on it.
Yeah, it can't be achievable na you just try one product and then,
And overnight.
yeah,
Yeah.
this will give me casket. There's no one size fits all talaga. But if you know how, if you, I'm going again to consultation kasi it's really hard to do DIY. Sometimes you don't know if there's an internal problem. And sometimes, the good thing about checking our skin, sometimes our skin shows us if we have an internal problem.
Oh,
Yeah.
okay. And it's also nice, Doc. Is it can you like help me out here? When for example, I'll go to the derma ganyan, and then I will say, Doc, I want my skin to look a little less oily ganyan. The doctor will help me with my skin journey.
Yeah, yeah. Because normally, the important thing with skincare or with consultations is the doctor really needs to see your skin. Di ba minsan kasi when you check online, like you're listening to someone and then you just get it na yung techniques niya. But they're not really able to see how your skin is reacting or how your skin is. So the best thing really for consultations is if, for example, we're face to face. I get to see your face. I get to ask you about your habits. I get to ask you about your techniques. Kasi sometimes there are some simple techniques also na you think it doesn't make sense, but when you're corrected, it will improve your skin a lot.
Really, like the smallest things.
Yeah, like,
Do you have a story about that, Doc? Yung parang change mo lang yung isang, of course, ng isang habit niya, and then their skin got better.
yeah. Or I think it's not that. It's more of like the habits that we do. Kasi sometimes, I think with skin, we're agitated na if you see there's a pimple, you want to keep rubbing it.
Yeah.
Diba? So, what I usually recommend, especially for teens, let's go to teens, kasi sometimes they're the ones na they're adolescents.
Yeah.
They're going through that stage. So, pag ganon, ang nangyayari, when they start seeing bumps on their skin, they're like panicking na parang, oh no, what's happening? I'm getting whiteheads. Usually, the bumps they see are whiteheads. Usually, you'd see the blackheads on the nose.
Yeah.
Yung pagtingin mo na, like, it looks darker.
Dark.
So, yon. Normally, what I recommend for them is not to over-scrub. Kasi your skin will not improve if you over-scrub. Sometimes, it will get worse.
Oh, okay.
Remember that you have to treat your skin gently. Na you just
Super gentle.
manage it. You wash your face properly. You apply toner if you feel like your skin gets a little more oily or you have a lot of activities. You palagi kang pinapawisan. Like you need to do additional care. And then you moisturize. So that's something that you should be doing. I've had the patient na I just gave her like a simple set. Like a soap, a toner, and a serum. And it worked. Like the bumps on her head or on her forehead were managed
Clear.
without
Oh,
her
oh.
like pricking anything. Yeah.
Oh.
Kasi these are like teens, diba? Normally we don't actually, I also don't want to traumatize them with
A lot.
they don't want to,
Yeah.
alam mo yan, I don't want to go back to the doctor kasi she told me to do this na parang it didn't work or it's painful. So, for me, especially for the young ones, madalas naman yan, hindi yan pumupunta mag-isa.
Yeah.
Sometimes they're forced by their parents. So, it's hard na pumunta na nga sila, tapos they're entrusting it to you, like, tapos masasaktan pa sila. So, yeah, so we really make adjustments, like we give them advice so that they just improve their skincare habits.
Okay.
Para they don't, and sometimes, like yung forehead, sometimes when you have bangs,
Ay.
it happens. Your
Flashback.
yeah, nai-irritate yung ano mo,
Yeah.
yung forehead mo. So makikita mo, it has an effect.
It has an effect. A while ago, you also mentioned about the bumps. Because right now, it's also a thing that we're talking about on TikTok. It's the skin texture.
Mm-hmm.
Does facial immediately also fix that? Like, the skin texture, like the ba yung parang similar to glass skin, pero this one is like, when people want to look no filter
Yeah,
in
yeah,
real
yeah.
life. So how can that help?
Yeah, it can help because when we do facials, we also recommend aside from the cleansing, the toning that we do physically, we also recommend photodynamic therapy. So PDT is like laser therapy.
PDT, photodynamic
Yes,
therapy.
it's a laser therapy wherein we adjust the treatment for your skin so that it addresses kasi your skin has three layers. It's the top layer, which is yun usually yung tinitreat. Second, yung parang dermis, nandun yung mga some vessels, yung collagen nandun. Sometimes hindi na yun naaabutan. But what we do with the PDT is we somehow allow the light rays to hit that area so that it stimulates
Oh.
the production of collagen. It stimulates um the improvement of the texture. So it's actually something that even doctors are shifting now na skin quality is really what's checked. It's not just na it looks okay kasi baka mamaya the quality itself it's dull, it's not plump, so it's affected. So skin quality is really that. You're concerned with not just what's on the surface, but knowing that it's healthy even in the middle layer. So usually with skin quality, there are lasers, there are light therapies, and there are um medications that can be applied. There are also something like skin boosters
Skin
that are
boost.
used so that it can be applied on the skin. But remember, if I was hesitating about the last part kasi pag ginamit mo na yun, it's more of may involved na needling.
Yeah.
So, minsan may ganon. So, but that can help improve the skin quality. So, it's really a balance of knowing what your skin is dealing with
Yeah.
and also knowing what you should use to supplement your skincare.
Yeah. And it's so exciting because I feel like we've just, tackled one.
Yeah.
Like we just tackled the top layer,
Yeah.
and then we're going to get deeper with our succeeding episodes, right, Doc?
Yes, of course. We'd like to just continue to inform everyone, 'di ba? That skincare is not hard, but you have to really know who to listen to, what to do for your skin, 'di ba? What to be educated about so that you can do it for yourself. Kasi that's something that we want our patients or our listeners to know that they can take care of their skin. 'Di ba? They should just have their dermas as their skincare partners.
Yeah.
But at the end of the day, it's gonna be you who's going to take care of your skin.
Yeah. So thank you so much, Doctora, for that lovely and very insightful time with you. So thank you guys. And if you are not yet following us on our Instagram and Facebook and TikTok,
Follow us on all our social media accounts. And if you have questions about your skin, about your hair that you want us to answer, or at least try to address in some of our episodes, you can send us a message or just type in the questions.